If you recently hit your head, you might be wondering if you need to go to the ER for an assessment or get a CT scan of your head. I'm going to walk you through a quick and easy way to determine if you need to go see a doctor using a clinical tool that we use in the ER called the Canadian CT Head Rules. So to begin, let's get the easiest criteria out of the way. The first one is your age. If you're over the age of 65 and you've fallen and hit your head, you should come to the ER for an assessment. And the reason that we care about age is because as you grow older, your brain naturally shrinks, and if you hit your head, there's a higher chance that your brain will shake within the skull and cause bleeding. If you're taking a blood thinner medication, your risk of a brain bleed will also be increased, and so you should come to the ER for an assessment. If you're having difficulty remembering what happened or fine details for over 30 minutes leading up to the injury, or if the person who hit their head is confused or very drowsy for more than 2 hours after the injury, or the person has vomited 2 or more times, these are all signs that there could be a potentially dangerous brain injury. We also really care about the mechanism in which you hit your head. So if you fell from an elevated platform of 3 feet or fell down 5 stairs, or you were walking across the street and hit by a car, or you're in a car accident and you're ejected from the car, these are all really high mechanisms that would predispose you to a traumatic brain injury. Lastly, physical signs that would be concerning would be if you run your fingers along where they hit their head and you feel a small crater, or if they have bruising around their eyes that kind of look like raccoon eyes, or if they have blood draining out of the ear. These are all concerning features that would warrant a visit to the ER. When you see a doctor, what you can expect is that they'll get a more detailed story of what happened, they'll do a physical exam, and they'll discuss with you whether they think that a CT scan is warranted. I do want to mention that this study was designed specifically for people who hit their heads and had a brief loss of consciousness, a lapse in their memory, or disorientation. So these guidelines won't apply to people with a very, very minor mechanism, like someone who opens a cupboard door and hits their forehead. And yes, I do see that in the ER all the time, because those types of mechanisms are going to be extremely low for a traumatic brain injury. However, if you're really worried or you're in doubt, we're in the ER to help. So share this with a friend or a family member and follow me for more medical insights from the ER.